Hey everybody, Tyler Johnson with Ursa Health. I have another great question from the community that I wanted to answer and share with all of you. Today's question is, can I take measure results and apply filters to narrow down to a specific subset of the population, and then take that population and see how those patients are performing across other measures in my report? Now, to answer that question today, I'm going to be walking through a feature of analytics portal called cohorts. So let's go ahead and dive in. So to get started today, I'm going to be jumping off from our Population Health Foundations report. You can use cohorts on any measure, but for today's example, I'm going to be taking a look at our patients with active membership registry. And like you would do with any analysis, you start slicing and dicing your population to better understand the data that is contained within this data frame. So for today's analysis, I'm going to go ahead and split up this population by the CDC SVI index, which shows which patients are living in areas with the highest deprivation or the highest levels of vulnerability. And for today's analysis, I'm going to filter down to just those patients who are living in the areas with the highest vulnerability. Now, I'm also going to split out their age tier and their engagement levels with their PCP, because what I want to take a look at is how many young adults that live in those areas of the highest deprivation are being pretty engaged with their PCP more than maybe a typical young adult would be otherwise. And I can see here that for folks that fall in the age ranges of 19 to 33, there's a pretty high concentration of patients who have seen a PCP more than 2 times in the last 36 months. So I'm going to apply a filter here that basically says, show me all the patients who have had 2 or more PCP visits in the last 36 months, who also live in those areas of highest vulnerability. And I have taken my population down to 186. Now, let's take this one level deeper to say, of those 186 patients, how many of them are dealing with chronic conditions? As you might expect with a younger population, you can see that there are a whole chunk of patients who fall into this cohort that don't have any CCW conditions, no known chronic conditions. I'm going to exclude those patients because really for today's analysis, I'm interested in diving into these 47 patients who live in the areas of highest vulnerability based on the CDC SVI index, who are in the young adult patient age category, and who are pretty engaged with their PCP, and they have at least one chronic condition. Now, since I've taken my overall patient population and filtered it down to these 47 patients that I care about for today's analysis, this is where I'm going to click the floppy disk icon up here by filters, where I'm able to save this list of 47 patients as a cohort, and I can use that cohort as reference in other measures in my report. For this example, I'm going to use patient ID. So of those 47 patients, I'm going to save off a list of distinct patient IDs that have all these filters applied. I'm going to give this cohort a name and say young adults with, we'll say CCW conditions. I have the option to share this cohort with others, or I can just keep it internally for myself. For today's example, I'm going to not check this box, and then you can give your cohort a comment. So I can say these patients are living in areas with high vulnerability, and they also have chronic conditions with high PCP engagement. All right. So after I give it a sufficient comment and a name, I'm going to submit this cohort. And now what the system has done is it has carved out the patient IDs for these 47 patients, which I myself filtered down to based on all of the analysis and slicing and dicing that I was doing. So with that cohort saved, I can now apply those 47 patients to any of the other measures in my report within Analytics Portal. Let's say that we wanted to take a look at our spending per URSA encounter, and this is at the population level. I can see that this value is floating between $530 up to almost $700 over the course of a year. I'm able to add a filter here that says, only show me the patients that are in the cohort that I just created, or in this young adults with CCW conditions cohort. So I can filter down this measure, and now it's only displaying results for those 47 patients. And I don't have to reintroduce every individual filter component that I put on the last measure. I can just easily apply a filter based on that cohort, and now it automatically filters down this measure result to those 47 patients that I care about for this analysis. From here, you're able to even drill in further to continue doing things like splitting and more filters, or dive into the case level detail. But Hopefully this was an easy way for you all to see how when you're in Analytics Portal and you're adding filters and focusing in on a subset of the population, you can save that subset as a cohort and then apply that cohort to other measures. If you have any additional questions after watching this video, feel free to reach out. Otherwise, you can always check out our knowledge base, which is docs.ursahealth.com, and there will be additional context and how-to guides over there. That's it for today's video. Thanks for watching, and we'll talk to you all soon. Thanks.